So this is the treatment for hip fracture, for femur fractures in pediatric age group. As we discussed, hip spica in less than 5 years. In 5 to 12 years, we can use either plates or elastic nails or rigid nails. However, in pediatric age group, since they are growing bones, we need to get them the implant out after complete healing. This is how a hip spica looks like. It covers the whole of the limb on the affected side with foot being free and the support, since we have to stop the movement of the hip, so the abdomen is taken into consideration. These are titanium elastic nails. This is how the fracture looks like. This is some sort of semi-rigid fixation, and once the fracture heals, like the picture C can be seen, then we tend to remove the nails. This is how a plate looks like for the fixation. After a good remodeling, we tend to remove the implant. Clavicle fractures are again quite common, secondary to fall, and usually they are treated conservatively. This is how a fracture of clavicle looks like. Usual treatment include figure of 8 bandage and collar and cuff sling, and majority of the time, no surgery is required. This is collar and cuff. So just look at certain fractures. This is a radial head physeal displacement. It needs to be reduced back. You always need to see a number of normal x-rays in order to get used to picking up abnormalities. This is again fracture of elbow. Here again, there's a scaphoid fracture. This is an ankle fracture in pediatric, which is Salter type 3 injury of distal tibia and fibular shaft fracture. This is neck of femur fracture in pediatric age group. It's particularly important that certain fractures need to get compression in order to get the complete healing. Just like hip fractures, they have synovial fluid around the fracture edges, and it needs to be compressed with screws so that we can get healing in a proper way. The second thing to remember is avoid cells crossing the cells with rigid implant as much as possible. This is again an elbow dislocation, not a very common picture. However, they tend to occur 1 in 1,000 patients. This covers our pediatric trauma, pediatric fractures, and fixation.